To begin with, we'll start with 21st century, the very century we are living in, and you might have seen so many outbreaks going on this in this century. So if we say that the 21st century is the century of outbreaks, it will not be wrong. We have seen SARS, MERS, we have seen the outbreaks of monkeypox, Ebola, Zika, Sudan virus, and the mighty COVID-19. Of course, everyone knows that. We are over I think 7 million people died, and around, I would say, 700 million people were affected. And then there is another challenge that is going to be in this globe is the ever increasing burden of antimicrobial resistance, multi-drug resistance organisms, and healthcare associated infections. So we will be, studying all these areas, how the whole concept is changing the public health in the world, the need of working together, need of working in close collaboration and coordination between different countries, and how it can save everyone in the world. So we have seen that the whole world has changed into a global village. Annually, there are over 1.3, more than 1.3 billion people travel across the world. So you can just imagine how many people are traveling on daily basis from one country to another country. So whenever there are people traveling from one country to another country, of course they are carrying their qualifications, they are carrying their expertise, they are carrying their businesses, they are carrying everything. But they can also carry microorganisms with them. They can also carry the infections with them. That is the main problem. So once there is an outbreak, and then if it is, a public health emergency of international concern, it is going to affect every country in the world. And for that component, international health regulation came in 2005. In fact, the international health regulation came even before that in 1969. And then before that, there were international sanitary regulations that were modified to international health regulations. But specifically, if you can see here in this slide, the International Health Regulation 2005 is a comprehensive book and document and framework, I would say, that is being implemented, and every country in this world is bound to implement international health regulation. So we will see what international health regulations are actually. The purpose of the scope of international health regulation are to prevent, protect against, control, and provide a public health response to international spread of the diseases in a way that are commensurate with and restricted to public health risk, and which avoids unnecessary interference with international traffic. So the main purpose of international health regulation, I would say there are two main functions. First one is to prevent the spread of infections beyond the borders internationally, of course, and the second component in a way that it is not going to affect international traffic. We have seen that in this, the global village, the economy of each country depends upon the economy of the whole world. So whenever there is, problem in any country, so of course there is going to be restriction in traveling. So whenever there is a restriction, there is a restriction on the trade as well. So trade is not only affecting the very same country that has this health problem, but also the other countries. For instance, the countries that are exporting goods, the countries that are providing services. So the main purpose of international health regulation was to make sure that everyone is safe internationally, and disease is not spreading beyond borders, and of course it is not going to affect international traffic as well. When I say beyond border, it doesn't mean that it allows that disease can spread in the country. It actually works on prevent, detect, and respond to infectious diseases, smooth, and of course smoother international trade. So that's the whole concept of international health regulations, and every country should and has to abide by these regulations, approved and implemented by World Health Organization. So all the countries across the world have signed to it, and most of the countries have signed to it, and they are, they have to comply with these regulations. Okay, for instance, all the countries are implementing it. How would WHO would know that the implementation of these international health regulation is up to mark or not? So that's another important question. For instance, one country says that, okay, I have implemented international health regulation and there is no need for, of any further component or further strengthening of international health regulation. So for that component, then there is joint external evaluation tool. So this joint external evaluation tool, it has three editions. So right now, if you can see the top right, that is the third edition that came in 2022, 2023. The purpose of this joint external evaluation is to assess the competencies of these countries, how they are implementing international health regulation, what is the status of international health regulation implementation in these countries. So joint external evaluation has actually 19 technical areas. We'll see in the next slide. So these 19 technical areas discusses each and every technical area that is needed to make sure that the country has is implementing prevent, detect, and respond to public health threats. So for that component in each technical area, then there are sub-technical areas. For instance, there are 56 technical areas, sub-technical areas. In antimicrobial resistance, there are 5 sub-technical areas. For each sub-technical area, there is a grading system, and it has 1 to 5. For instance, one skill would be no capacity at all, then the limited capacity, and so on. I mean, it will then go beyond it, some capacity, and then the capacity is already there, and then the country has demonstrated it, and then on the fifth one, that the country has the competency, but it also has sustained it. So there are 1 to 5 scores of each sub-technical area. So on the basis of those sub-technical areas, the country's presence, I mean, implementation of IHR is then assessed. But we have to make sure that, I mean, I'm going to share it, that the joint external evaluation is not compulsory for every country, for any country. It is more of the volunteer approach. For instance, Pakistan has had its joint external evaluation, second joint external evaluation in 2023. So Pakistan would say, okay, I'm ready for joint external evaluation, and it would be better if WHO EMRO, because we are in EMRO region, can come and conduct joint external evaluation. On the basis of that, we would know where we exist and what are the gaps in implementation of IHR. Once we have those gaps, and then we are going to make sure that we fill those gaps. So that's what happened in 2023. There was initially a self-evaluation just for us to understand where we stand, and then the EMRO team came in 2023 and they conducted joint external evaluation. And we will see from the next slide what are the different component of it. So here you can see that there are 4 major components: prevent, detect, respond, and health hazards, including point of entries and border health services. So for each major technical area, then there are sub-technical areas. The key, as I mentioned, there are 9 technical areas. So 19 technical areas. It includes legal instruments, financing, IHR coordination, AMR, zoonotic diseases, food safety, biosecurity, and immunization under prevent area. And then under the detect component, there are 3 major technical areas: national lab system, surveillance, human resource. The third one is respond. Under respond, we have health emergency management, linking public health to security, health services provision, infection prevention and control, and RCCE, that is risk communication and community engagement. Under the fourth area of related hazards, for instance, point of entries and border health services. These are actually the point of entries are actually the borders from where people may travel from one country to another country. These can be the airports. These can be, the other point of entries. For instance, there are so many borders between Afghanistan and Pakistan and Iran and Pakistan. So these are also, it doesn't mean that it is the, it's an airport. It can be the other dry point of entries as well. So under each technical area, then there are sub-technical areas. For instance, legal instrument, there are 2 sub-technical areas. And then in financing, there are 2 sub-technical areas. In IHR coordination, there are 3 sub-technical areas. So if you can see, there are scoring. I gave actually the scoring in front of each component. So whoever is joining outside of Pakistan, so for them it is the main. This slide actually shows the main technical areas, and then its sub-technical areas. For people who are from Pakistan, from them, I think it is important to understand, because the numbering given here are the scoring of Pakistan as the base of joint external evaluation that happened last year. For instance, in legal instrument, there were total 10 scores because there are 2 sub-technical areas, and every sub-technical area has 5 scoring, as I mentioned previously. So out of 10 scores, we got 4 scores. For instance, it can be 2 scores in each, it can be 3 plus 1. But still, I would say we are in here in legal instrument, we have some capacities. It is not a low no capacity, but we have some capacities. And we will understand, of course, why we have, the scoring system is 4 out of 10. And I would be, to some extent, I'll be discussing it in Urdu as well for all those people from Pakistan, because it's more about Pakistan component. हम सब जानते हैं कि 18th अमेंडमेंट के बाद लीगल सिस्टम्स जो है, हेल्थ जो है स्पेशली, ये प्रोवेंसेस में चला गया है. तो हेल्थ इज द मेन सब्जेक्ट ऑफ द प्रोवेंसेस. प्रोवेंसेस हेल्थ एजुकेशन और दूसरे कुछ एरियाज है जिनको प्रोवेंसेस इंप्लीमेंट कर रहे हैं. और जबकि जो इंटरनेशनल हेल्थ रेगुलेशन है, ये ज्यादा फोकस करता है कि आपका नेशनल लेवल पे एक ऐसा सिस्टम हो जो कि जब भी कोई आउटब्रेक हो वो नेशनल लेवल से सेंट्रलाइज उसको अप्रोच करे. बट अगेन, after 18th amendment, and then of course there are so many other component as well, जिसमें हमें लगता है कि अभी भी बहुत ज्यादा लीगल सिस्टम को मजबूत करने की जरूरत है. there should be something, there should be legal system जिसमें वो कोई अटॉनमी या आई वुड से कोई एम्पावर करे किसी सेंट्रलाइज बॉडी को जो कि किसी भी आउटब्रेक में काम कर सके. फॉर इंस्टेंस एनसीओसी, कोविड-19 में हमने देखा कि एनसीओसी ने इस्लामाबाद से पूरे पाकिस्तान के अंदर कोविड-19 को रिस्पॉन्ड किया. सो दैट वाज अ रिएक्टिव मोड. कोविड पेंडेमिक आई एंड देन एनसीओसी एस्टैब्लिश हुआ और उसने पूरे पाकिस्तान में कोविड को रिस्पॉन्ड किया. बट इट शुड बी प्रोएक्टिव. आई मीन, हमने इंतजार नहीं करना कि कोई पेंडेमिक आएगी और फिर हम कोई नया एनसीओसी लेके आएंगे. देयर शुड बी लीगल इंस्ट्रूमेंट्स टू सपोर्ट इंटरनेशनल हेल्थ रेगुलेशन. And then if we see the all different scoring system, of course you can understand financing 4 by 10, we have financial issues, especially in context to the health. That's what I'm saying. And international health regulation, there are 3 sub-technical areas, we got 6 score. And if we can see in the end, and then in the detect, we have national lab system that is under 10 by 20. We have the lab system in the major provinces and major health facilities in the major cities. But of course, we need to strengthen that as well. And in surveillance, we have 9 out of 15, human resource 7 out of 20, because in human resource, we have 4 sub areas. Under 4 sub areas, of course, it includes multiple things. And we know we are facing problems with human resource, not only in the clinical side, but also in the public health side. So for instance, there is an emergency, there should be human resource to address that. And then if we come to the response component, health emergency management. So health emergency management, we have public health emergency center in NIH now, but it should be in the provinces as well. It should be coordinated one. Whenever there is a threat, it should automatically activate and work in the provinces. For that, we need legal instrument, we need resources, not only the financial but also human resource as well, and of course the surveillance system. तो ये सारे के सारे कंपोनेंट एक दूसरे के साथ मिलके चलते हैं. It is not like एक कंपोनेंट होगा तो दूसरा होगा. That is the whole concept of including all these areas under this joint external evaluation and international health regulation. क्योंकि जब भी कोई हम ये कहते हैं कि आउटब्रेक आएगी, तो आउटब्रेक को टाइम पे प्रिवेंट करना है, और अगर वो आ गई है तो उसको डिटेक्ट करना है टाइम पे और उसको कंट्रोल करना है. फॉर दैट हमें पैसा भी चाहिए, हमें लीगल सिस्टम भी चाहिए, हमें ह्यूमन रिसोर्स भी चाहिए, हमारा सर्विलेंस सिस्टम भी चाहिए, लैब भी हमारी अच्छी होनी चाहिए, हेल्थ इमरजेंसी सिस्टम भी होना चाहिए, सिक्योरिटी इदारों के साथ जो है पब्लिक हेल्थ के लिंकेज भी हो, क्योंकि बॉर्डर और बाकी एशिया जितनी भी चीजें हैं, देयर इज अ लिंक बिटवीन सिक्योरिटी एंड पब्लिक हेल्थ, and so on, in if I can say in infection prevention and control as well. So for instance, the same as risk communication. हमने कोविड में देखा है कि देयर वर सो मेनी मिसइंफॉर्मेशंस गोइंग ऑन, देयर वर सो मेनी प्रोपेगेंडास गोइंग ऑन अगेंस्ट द वैक्सीन फॉर इंस्टेंस. So risk communication and community engagement is also part of it. So these are different scoring, and of course we will see in coming slides as well. So now what the global health security agenda is. What was the need of this global health security agenda? Because there was already international health regulation. And if we see the global health security agenda, so it talks about prevention of avoidable catastrophes, detecting threats early, respond rapidly and effectively. It's actually making sure that the global health security is strengthened. Whenever there is an outbreak, whenever there is a public health emergency, the countries are able to prevent, detect, and respond. So the question will, I mean, there can be a question there is already international health regulation going on since 1969 and 2005, then why there was a need to bring global health security agenda in 2014? So actually, the global health security agenda was, I would say, the brainchild of US CDC, because international health regulation was there already there, but countries were not able to implement to the extent they should, owing to so many reasons. There are few countries that have resource problems. There are few countries who have, I mean, there can be commitment issues. There can be infrastructure problems. So for that component, US CDC actually brought this idea of global health security agenda. So you can say to some extent, in other words, that this is the brainchild of US government and of course US CDC. So US government and CDC thought that, okay, we are going to support all these countries who are unable to implement IHR to its good extent. So for that they raised, the financing component, and then they supported these countries. Pakistan is also part of global health security, and then there are permanent members. Then there is global health security consortium. Annual meetings are going on, and multiple funding opportunities are given to different countries to implement IHR. For instance, Pakistan is receiving global health security agenda funding. Uh, National Institute of Health has GHS funding from CDC. Jhpiego also has funding from global health security agenda, and we are implementing it since 2020. We'll share in the last few slides, uh, you know, uh, what we have been doing and what global health security agenda is. So now what we see, what global health security agenda has to offer. So it has six major technical areas. I would say the major chapters. Three are the exactly same as of IHR: prevent, detect, respond, and the three are health, norms, and risk. For prevent component, we have AMR, antimicrobial resistance, zoonotic diseases, biosecurity, biosafety, dual research, immunization. For detect, we have lab system strengthening. You would recall that IHR detects component. It includes only three main components: national lab system, surveillance, and human resource. And here in detect, it has lab system strengthening, lab supply chain, real-time surveillance data, availability and transparency, case-based investigation, and epidemiology workforce. So they actually expanded that component. So make sure whenever they are funding any country, for what specific component they are funding. So they can strengthen the lab system, but the country is unable to provide continuous and sustained supplies. What is the purpose of this? लैब अच्छी से अच्छी हम बना के अगर छोड़ भी दें, अगर उसके अंदर हमारे पास सप्लाईज मौजूद नहीं है, अगर हमारे पास एचआर मौजूद नहीं है, तो उसका कोई पर्पस नहीं है. तो इसीलिए ग्लोबल हेल्थ सिक्योरिटी एजेंडा ने उसको थोड़ा सा मजीद एक्सपैंड किया है. सो दीज आर द डिफरेंट टेक्निकल एरियाज अंडर डिटेक्ट. And then if we go to the respond component, there are emergency preparedness, exercising response plans, that is also important, emergency response operations, linking public health and security, risk communication, access to communication infrastructure, trade and travel restrictions. The next three are health capacity in hospital and community, supply chain, medical countermeasures, healthcare access, communication with healthcare workers during emergency. हमने कोविड में देखा है कि जब शुरू में कोविड आया, तो जो हमारे हेल्थ केयर वर्कर्स हु वर वर्किंग इन द हॉस्पिटल्स, समहाउ उनके साथ प्रॉपरली हम लोग कनेक्ट नहीं कर पाए. तो देयर वर सो मेनी प्रॉब्लम्स गोइंग ऑन, देयर वर सो मेनी चैलेंजेस, अनसर्टेनिटीज थी, लोग डरे हुए थे. रीजन बीइंग देयर वाज नो कम्युनिकेशन बिटवीन हेल्थ केयर वर्कर्स and of course those who were managing it. But of course then this communication was strengthened, and then we achieved this component. IPC, infection prevention and control and equipment, capacity to test, deploy new countermeasures. There is a new challenge coming on, so there should be a capacity. Next point is norms, international health regulations, reporting compliance, cross-border agreement, international commitment, JE, PVS. PVS is exactly like JE in human sector, PVS is in animal sector. Financing, commitment to sharing genetic and biological data, and in risk, political security risk, socio-economic resilience, infrastructure, environmental risk, and public health vulnerability. I'll go, to the previous slide just to show that as per the Global Health Security Index 2021, these are the numbers, if you can see, that shows the preparedness of Pakistan in GHS. उससे पहले जो हमने IHR में देखा था वो 2023 की रिपोर्टिंग है. एंड दैट इज एज पर ज्वाइंट एक्सटर्नल इवेल्युएशन ऑफ इंटरनेशनल हेल्थ रेगुलेशन। ये जो स्कोरिंग है ये ज्वाइंट जो है ग्लोबल हेल्थ सिक्योरिटी एजेंडे की है। इट इज आउट ऑफ 100। उसके अंदर स्कोरिंग 1 to 5 के हिसाब से थी और इसके अंदर आउट ऑफ 100 है। फॉर इंस्टेंस इन एंटीमाइक्रोबियल रेजिस्टेंस वी हैव 25 स्कोर्स आउट ऑफ 100। इसके अंदर हमारे पास एंटीमाइक्रोबियल रेजिस्टेंस के अंदर सर्विलेंस का कंपोनेंट अच्छा है, बट प्रिवेंशन ऑफ एमडीआरओज और अदर कंपोनेंट नीड अ लॉट more to do, you know. And then for instance we see in any component biosecurity we have 20 scores. Lab system strengthening we have 75. As I mentioned previously, there is lab system in the country in major hospitals, major cities and national and provincial level. So lab system strengthening is there, but कुछ एरियाज इसमें ऐसे हैं जिसमें आपको स्कोरिंग नजर नहीं आ रही। तो वो क्योंकि इसको इवेल्युएट कर रहे होते हैं तो कुछ एरियाज ऐसे होते हैं जिसमें उनके पास अगर डाटा ना हो तो देन दे उसको जीरो कर देते हैं। तो इस वजह से मैंने जीरो नहीं लिखा। एक्चुअली काम हो रहा है, बट ऑफ कोर्स जीएचएस इंडेक्स में वो रिफ्लेक्ट नहीं हो पा रहा। हमने देखा जैसे वेयर इज आईपीसी बाय द वे, वी सा हियर इन आईपीसी, यहाँ पे भी उन्होंने स्कोरिंग नहीं दी हुई, लेकिन आईपीसी में हमने वहां देखा हमारे पास 4 स्कोर हैं, 4 आउट ऑफ हाउ मेनी 15। इन आईपीसी वी गॉट 2 आउट ऑफ 5, healthcare associated infection we got 1 out of 5, safe environment we got 1 out of 5. That are the 3 sub areas of IPC. So here they gave 0 because it mainly addresses in global health security agenda the healthcare associated infection. Healthcare associated infection वही infection है जिसको हम previously nosocomial या hospital acquired infection कहते थे। इसी तरह ये scoring है। अब here you can see actually the comparison of joint external evaluation and GHS index. So in 2023, Pakistan received overall 43% scores. टोटल 280 सब उसके स्कोर थे 5 के हिसाब से, और उसमें से हमने 121 स्कोर हासिल किए। और जीएचएस इंडेक्स 2021 में हमारा स्कोर 30 है, 30.4। तो 195 कंट्रीज में वी आर एट 130th नंबर। सॉरी, someone's mic is on. And if there is any question, please let me know. So in joint external evaluation, in prevent section, we got 43%. But in GHS index, we got 17.1. In detect, we got in GAEE 47%. And in GHS index, we got 29.2. Reason being, each tool has their own definition and each tool has their own indicators to assess. But especially in GHS index 2021, I would like you to see last 3 lines. In South Asia, Pakistan is on 8th number out of 9 countries. हम 9 कंट्रीज जो साउथ एशिया के उसमें 8वें नंबर पे हैं जीएचएसए में। एज पर 2021 वो कंट्रीज जिनकी आबादी 10 करोड़ से ज्यादा है, टोटल 13 कंट्रीज हैं और उसमें हम आखिरी नंबर पे हैं। लोअर मिडिल इनकम कंट्रीज में 45 कंट्री हैं जिसमें हम 27 नंबर पे हैं। सो दैट इज एक्चुअली इट स्टेट्स वेयर वी आर राइट नाउ इन जीएचएस इंडेक्स in 2021. Of course, after COVID-19, there has been so many things, there have been so many improvements going on, and it is not reflected in GHS index. But as per 2021, this is the scoring. And you can, by the way, go and Google it as Global Health Security Index. They have the website, and then you can see the score of Pakistan. Why it is not moving forward? Okay. After joint external evaluation, Pakistan is developing, and it has almost developed national action plan for health security. मैंने शुरू में बात की थी कि जब भी ज्वाइंट एक्सटर्नल इवैल्यूएशन होती है तो उसकी बेस पे उसका मेन पर्पस ये होता है कि टू आइडेंटिफाई आवर गैप्स। once we know what our gaps are, then on the basis of that there are recommendation, and the basis of recommendation we actually take steps. Development of national action plan is one of the most important step. In this action plan we actually decide that on the basis of our gaps we are going to fulfill all these gaps through this action plan. इसके अंदर ये भी होगा कि कौन कौन सी एक्टिविटीज हैं, किस सूबे की क्या जिम्मेदारी है, सूबे के अंदर किसकी जिम्मेदारी है, बजट क्या है, इसमें कितने रिसोर्सेज चाहिए, इसमें कितना एचआर चाहिए, एवरीथिंग. So National Action Plan for Health Security 2024 that I'm hopeful is going to be approved in this month, maybe in August, if not in end of July. It has following the main areas that are the main focus. First one is legislation. there is a need for legislation, and that is part of national action plan, to make sure that whenever there is an emergency in the country, legislation ऐसी हो कि वो उसको सपोर्ट कर सके. पब्लिक हेल्थ इमरजेंसी मैनेजमेंट, जैसा कि मैंने कहा कि हमारे एनआईएच के अंदर एक पब्लिक हेल्थ इमरजेंसी मैनेजमेंट सेंटर मौजूद है, बट इट इज आल्सो नीडेड इन द प्रोविंसेस, and then there is coordination needed, and then of course the other purposes as well. Health resources, it includes the financing as well as the human resource. One health approach, so one health approach for, because there are students here as well, so one health approach talks about bringing every sector together to work for the public health component and for the health component, I would say. Human health, animal health, agriculture, environment. Why? There are so many diseases, zoonotic diseases, जो कि एनिमल्स में भी हैं और ह्यूमंस में भी हैं. CCHF, क्रीमियन कांगो हेमोरेजिक फीवर, सो ये जानवरों में भी होती है, इंसानों में भी होती है. रेबीज इंसानों से जानवरों से इंसानों में आती है. तो ये बहुत सारी ऐसी बीमारियां हैं जो इंसानों और जानवरों दोनों में पाई जाती हैं. तो उसके लिए देयर इज अ नीड के सारे डिपार्टमेंट इकट्ठे बैठ के काम करें ताकि उन डिजीजेस को रोका जा सके. दैट इज द कंसेप्ट ऑफ वन हेल्थ. And then IPC, infection prevention and control, and antimicrobial resistance, early warning system, and strong surveillance and diagnostic system. Okay, now the second component of this talk is the community to global health. जैसा मैंने पहले भी आपसे कहा, फॉर इंस्टेंस किसी भी शहर में, किसी भी गांव में कोई भी इंफेक्शन होता है तो उसका डर है कि वो उस गांव से, उस शहर से दुनिया में कहीं भी फैल सकता है. फॉर इंस्टेंस आई वुड से, व्हाई इट इज नॉट वर्किंग, देयर इज पुअर हेल्थ इंफ्रास्ट्रक्चर इन एनी सिटी, इन एनी विलेज. अपने किसी भी विलेज, किसी भी सिटी का खुद माइंड में रखें कि वहां पे कोई भी इंफेक्शन प्रिवेंशन कंट्रोल मेजर्स नहीं है या हेल्थ इंफ्रास्ट्रक्चर नहीं है. व्हाट विल हैपन? Healthcare associated infection or other infection in health facility as well as in the community. Infection कहीं पे भी हो सकता है. वो infection जो है लैब से भी निकल सकता है, वो कहीं पे जो है जो माइक्रो ऑर्गेनिज्म है वो कहीं से कम्युनिटी में से भी राइज हो सकता है, वो कहीं से भी राइज हो सकता है. अगर वो पेशेंट कम्युनिटी से या हॉस्पिटल से इंफेक्शन लेके किसी भी हेल्थ फैसिलिटी में जाता है और वहां पे उसको टाइमली डिटेक्ट नहीं किया जाता और उसको कंट्रोल नहीं किया जाता तो क्या होगा? ये आउटब्रेक की शक्ल इख्तियार कर लेगा. 1 से 2, 2 से 4, 4 से 6, डिपेंड करता है कि ऑफ कोर्स इन्फेक्टिविटी क्या है उस माइक्रो ऑर्गेनिज्म की. मगर वो जो जितना भी माइक्रो ऑर्गेनिज्म, जितने भी इन्फेक्शन काज कर रहे हैं, वो एक जो कम्युनिटी में एक शख्स था उससे वो फिर नियर बाय एरियाज को इन्फेक्ट करेगा. अब वो एक केस नहीं रहेगा, देन इट विल बी एन आउटब्रेक और एपिडेमिक. और अगर उस लेवल पे फर्ज करें लाहौर के अंदर या कराची के अंदर कोई भी इस तरह का इन्फेक्शन है, किसी हॉस्पिटल में गया, वहां से कंट्रोल नहीं हो सका और वो उस पूरे शहर में फैल गया, नाउ द थ्रेट इज टू द होल सिटी. लेकिन अब बात यहां तक भी नहीं रुकती. अब कराची, लाहौर, इस्लामाबाद से लोग कंटिन्यूसली दे आर मूविंग फ्रॉम द कंट्री, आउटसाइड ऑफ द कंट्री. They can be traveling to Middle East, they can be traveling to US, they can be traveling to Europe, they can be traveling to anywhere. So they will carry that infection with them. So it started with the community or in the healthcare facility, and from there, because it was not controlled on time, now it is the global health problem. That is the main concept, how community infection from community are the risk to the global health. We'll see one example. COVID-19 सबको पता है, right? So we assume that the first case of COVID-19 started in Wuhan, China, at the community level. सीपोर्ट थी, वहां पे जो है ये इन्फेक्शन आया. वहां उस इन्फेक्शन से क्या हुआ कि फर्ज करें, आई मीन इट्स कंप्लीटली हाइपोथेटिकल, कि वो पेशेंट जो भी था स्पेसिफिकली वो हॉस्पिटल में नहीं जा सका या वो टाइमली डिटेक्ट नहीं हो सका. व्हाट विल हैपन? सॉरी. उसके बाद क्या हुआ? न्यू ईयर सेलिब्रेशन चल रही है चाइना के अंदर. वो एक केस ने कोविड-19 ने दूसरे को अफेक्ट किया, 2 ने 4 को किया, 4 ने 8 को किया, 8 ने 16 को किया. So there was an outbreak within that city. Once there was an outbreak, because people were traveling from that city to internationally, that infection went global. तो अब वो कोविड-19 सिर्फ चाइना में नहीं था, अब वो अमेरिका में भी था, कनाडा में भी था, यूरोप में भी था, एशिया में भी था, अफ्रीका में भी था, ऑस्ट्रेलिया, न्यूजीलैंड, एवरीवेयर इन द होल वर्ल्ड. That is the concept of community to global health. Because the whole world is a global village now, so whenever there is an infection in any community, it can affect the whole world. From here, I'll try to be, speed it up. So what is the early warning system? So early warning system is actually timely prevent, detect, respond to public health threat before it is a risk for the other people in the country and within that country as well. So इसमें होता क्या है? इसमें सबसे पहले we identify कि hazards क्या है और risk क्या है. कौन सा इन्फेक्शन है, कितना चांस है कि वो दूसरों को अफेक्ट कर सकता है. तो हैजर्ड क्या है और रिस्क क्या है, उस रिस्क की असेसमेंट की जाती है कि ओके दिस स्पेसिफिक प्रोवेंस हैज दिस मच रिस्क. आप फॉर इंस्टेंस मीजल्स का रिस्क जो है सिंध के अंदर या पंजाब में इतना है. ऑन द बेसिस ऑफ दैट रिस्क हमने क्या करना है, प्रिपेयर करना है. देन वी विल बी कलेक्टिंग डाटा, सर्वेलेंस सिस्टम, डाटा एनालिसिस होगा, थ्रेशोल्ड एंड ट्रिगर्स दिए जाएंगे. ओके अगर फर्ज करें कॉलरा के केसेस इतने आ रहे हैं तो देन इट विल ट्रिगर दैट थ्रेशोल्ड और फिर रिस्पांस हम स्टार्ट कर देंगे. इसी तरह फर्ज करें किसी भी और डिजीज का, सीसीएचएफ का या किसी का, जब इतने लेवल हो जाएगा आफ्टर दैट it will trigger of course and then there will be issuance of the alert. After that there will be evaluation and feedback. Capacity building and training will be done, integration, collaboration, and continuous improvement. The whole concept of this early warning system is to make sure that any public health emergency of international concern or any public health threat is timely prevent, it is timely detected and contained and controlled, and it is prevented from spreading from within the country and from outside as well. So what are the existing surveillance system in the country, by the way? Integrated disease surveillance system and response, it is actually a syndromic surveillance. uh, ये सबसे ज्यादा एक्सटेंसिव सिस्टम है पाकिस्तान के अंदर. देयर आर I mean so many, I think I don't know exactly how many, but I think 130 districts or more than that are reporting on IDSR. So what happened here, whenever any patient comes to any healthcare facility in that district, they will write it down and then they will share that data with district health officer. District health officer will actually review it and then they will share with National Institute of Health on national level. So National Institute of Health will then analyze it. So if they see, for instance, there is any outbreak or there is any trigger going on, they will continuously initiate the response mechanism. They will also dispatch their teams. They will also guide the provinces that okay, this outbreak is expected and we have to respond accordingly. So that is actually the integrated disease surveillance and response system. One of the, by the way, one of the best surveillance systems so far in the country. And also the polio eradication initiative. We also know that the disease surveillance of the polio specifically is a very robust and active surveillance system in the country. Then district information management systems are there. Sentinel sites is a surveillance system. For instance, influenza-like illness and sentinel sites are there. That's another surveillance system. Event based, for instance, some event happened and it is not, it may or may not be very specific, but it is a public health threat. So on the basis of that, the surveillance system initiate and then they respond. Electronic disease early warning system, tuberculosis surveillance system, NTP has their own surveillance system, by the way. Healthcare associated infection surveillance system, NIH piloted this last year, and now they are actually working to expand it. The hospital-based surveillance system, dengue surveillance system, and in Punjab, they also have one disease surveillance system. So the crux of the whole discussion is actually that any individual health threat in the community is actually the global health threat. That is the main concept of this global health security. The purpose of this presentation is actually to orient you guys. Of course, there will be participants who are well trained on that, but then there will also be the participant who are just fresh graduates, just to make sure what global health security is, what international health regulation is, what the surveillance system and early warning systems are. And of course all of these areas have so many needs for the technical expert. All these areas have the need for medical, dental, and public health professional to work. So that's the whole concept of bringing this topic in APDSA, this conference. And after that, I just have 2 slides on Jhpiego, what Jhpiego is doing in the country, in the world. Right now, we have presence in over 40 countries. And in these 40 countries, these are the whole technical areas where we are working: maternal newborn child health, family planning, women cancers, adolescent and youth health, primary health care, immunization, nursing, midwifery, safe injection practices, and then COVID-19 emergency infectious diseases. After that, there is HIV, malaria, TB, infection prevention and control, innovations, learning and performance, gender and equity. So that's what we are doing across the world. So what we are doing in Pakistan, by the way, in Pakistan we have 10 different projects, but here I specifically mention about GHSA because I mentioned we started in late 2020, and of course from 2021 till 2024, Jhpiego is supporting global health security agenda in Pakistan, and of course the main lead is there is NIH Pakistan. So under Jhpiego Pakistan, we are implementing lab system strengthening. It includes biosafety, biosecurity. I of course know, hope that everyone and especially the fresh graduates, they know what is the difference between biosafety and biosecurity. Quality improvement, genomic surveillance system, and bioinformatics. That's what we are doing in lab. Then infection prevention and control, our national prevention and selected healthcare facilities. Surveillance system, we supported IDSR in few districts of Balochistan, emergency response operations, rapid response teams, risk communication and community engagement, and then emergency operation centers, One Health, and training information management system. So that is what we are doing in Pakistan. So after that, I'll be coming back uh, to all the participants for question answer sessions. You can ask your questions in the chat box. You can ask question. I mean, of course, I'll hand it over back to Fatma, and she may moderate it. You can ask directly as well. Over.
Thank you so much, Dr. Sobhan. It's very interesting learning about the infrastructure of health and the different factors that go into actually contributing to the better health of a nation and globally as well. So the first question that have is, what are the skills that undergraduate students can develop in order to help them with a career in public health, especially at our level in undergrad?
Okay, especially in Pakistan, I'll start from Pakistan. I was doing MBBS, there is one subject of community medicine, and then it is also community dentistry as well. So most of the time we are focusing on passing the exams. That's how it works. But still, I think public health and preventive health is the basic of all health system across the world. You see, for instance, uh, which country has the best health system? It can be Switzerland, it can be, Luxembourg has the best, by the way, and then Cuba, and then there are so many countries that have a very good health system. What's the basic of that health system? That is the preventive health, that is the public health. It is not the curative health. Curative health is important, मगर उन कंट्रीज में सबसे पहले कोशिश की जाती है कि डिजीज को पहले ही कंट्रोल कर दिया जाए, बजाय इसके कि वी वेट फॉर द डिजीज वो क्रोनिक बन जाए और उसके बाद फिर हॉस्पिटल में आए. सो फॉर दैट कंपोनेंट इट इज वेरी इंपॉर्टेंट वेन एवर यू आर वर्किंग एंड यू आर स्टडिंग कम्युनिटी मेडिसिन. It can be in MBBS, it can be in BDS, it can be in nursing. Make sure to grasp the basic concept of epidemiology. That's very important, by the way. And then there is research component in community medicine as well. There are researchers. Always try to be engaged with any public health institute in the country. We have National Institute of Health at national level, and in the provinces we have health systems. DG health system is there. Then there are PDSRUs, that are provincial disease surveillance and response units, and then CDC, for instance, Pakistan CDC in Islamabad, and then provinces have their own CDCs, Center for Disease Control. So whenever you are working in this community health as well as in the research, do at least have some time to visit these departments just to understand what they are doing, and then align yourself, align your research as well as community medicine component with that national priorities. Other than that, we can have international guidelines, for instance, the website of WHO, CDC, at least these two guidelines, and then I would say National Institute of Health Pakistan. These are the three main, I would say, website that actually gave you the current problems in the public health. Once you don't know, of course, the basic of public health and what are the challenges in public health, you cannot, realign that. And of course, for instance, I'll just give one example for all those who have completed their house job. So 90% of clinical profession is decided in the house job. So whenever we are doing house job, we say, okay, surgery में मैं ज़्यादा comfortable था या medicine में ज़्यादा था या gynae में या peds में, because we work there, we get ourselves oriented with that field. only then we can decide, okay, we are going with this technical areas. So same is with the public health. Do orient with yourself with all these department, as I mentioned, and of course the national and international guidelines, to see what are the needs, what are the gaps, and where these technical areas and these preventive health is moving. That's the first step, I would say.
Right, thank you so much. That actually does answer a lot of questions we've had in the previous days as well, because everyone mentions the NIH, but you're the first person to actually tell us about the different district health centers as well, where our students can go and acquaint themselves with different public health opportunities, figuring out how they can learn more and get more exposure about the different specialties within public health as well. So you did touch upon the different measures that we as Pakistan can take to improve our ranking in the Global Health Security Index. Are there any specific, what do you think, is there any role of youth-led programs in that, in improving that index as well? Or is there anything that we as students can do to help with that?
Yes, of course. I mean, as I mentioned, the public health, it actually starts with the public component. So it is led by, and it should be led by the public. For instance, I mentioned about early warning system. I mentioned about infection prevention and control. So the awareness, health education, and health promotion, these are the three major components. For instance, we have a stronger mechanism of reporting any public health threat, any health disease, I would say the health threat that will come under risk communication and RCCE, that will increase our RCC component. We can increase the surveillance system. You just mentioned the district component. So in every district there is one DDSRU, that is actually disease surveillance and response unit. Exactly like at the provincial level, there are provincial disease surveillance and response unit. So these are the DDSRU on the provincial level. So you are in the province, for instance, you are working, you are just living in the community, you just observe, okay, there are unusual measles cases going on in your village, for instance, in your neighborhood. Just report it to the DDSRUs. These DDSRUs are actually working under DHO or CEO. For instance, in Punjab, they have the different system where CEO health is the major district head of the health, and then under him or her there are DHOs. Then there is one DHO preventive health. So these DDSRUs are working with him or her. So you can report it to your respective district. So that's where you are actually supporting it. You are timely reporting the major public health threat. That is the main problem with global health security and IHR. The first and foremost thing is to timely detect and report it, because if we don't report it on the time, there will not be any response, right? So as a youth, I think it is very important we can conduct multiple awareness campaigns within our college, within our institutes, within our working places, within our community, whenever we are visiting a different surroundings and different cities and villages. That's the one component. The second component is to aware the community about the reporting mechanism, how to report it whenever you feel as anything going on. For instance, there was some issue going on a few months back when there were so many measles cases coming in almost all the country, but reporting was a bit late, because from the community level, initially it started in few villages and few provinces. Of course, I'm not going to take the name, but because in those villages people were going to the local healers. उस मखसूस विलेज में जो लोकल हीलर्स हैं, जो मखसूस क्वैक्स हैं, वो उनके पास जा रहे थे और वो रिपोर्ट नहीं हो रहा था ऑन डिस्ट्रिक्ट लेवल। तो क्या हुआ कि एक मिजल से दो लोग इन्फेक्ट हुए, 2 से 4 हुए, 4 से 8 हुए। जब वो 18 या 20 तक हुए, फिर वो हेल्थ फैसिलिटीज में रिपोर्ट होना शुरू हुए। From those health facilities, then it went to district and then on the national level. So the basic component is, I would say, health education and promotion, that what we can do, risk communication and reporting mechanism that we can support on any level. It does not mean where you are working. Even if you are in a house job or jobless, you can work on that, and that is the basic of GHSA as well as IHR.
All right. So one more question is that as students, are there any opportunities for research or internships in organizations like Jhpiego? We did have a session where we discussed WHO internships. So could you shed some light on that as well, please? Thank you.
Yes, of course, there are so many organizations that are offering multiple internships, research opportunities, and of course, it includes from National Institute of Health, provincial health departments, WHO, UNICEF, UNFPA, and on the other side, Aga Khan Foundation is also working on that. And then there are international organizations. In international organizations, I would say Jhpiego is there, JSI, UKHSA, FCDO, uh, Palladium, I would say Pathfinder. There are so many organizations that are offering. For instance, we offered internship and few opportunities, I think 2 weeks ago, and then we also finalized people. So we just have to approach these organizations, and it doesn't. There are few organizations that actually post these opportunities on their website. And you can see on Brightspire, if you can see on the Brightspire website, there are so many opportunities going on. And then there are Rosie.pk that has UN jobs on it. And then in that, you can see WHO, UNICEF, UNDP, UNFPA, FAO. There are so many organizations that actually post on daily basis all of these opportunities. These are not only the research as well as an internship. These are initial, I would say, early career different jobs. I would say officers, coordinators, etc., etc. So these are the ways from where you can actually start. And then, of course, Indus Health Network and other private health networks are also working at national level. So all of these organizations have their own websites, and you can just go and see on that. For Jhpiego, we offer multiple opportunities. Previously, we have been, offering so many opportunities for management sciences and other component, and now we are also offering public health. For instance, we actually hired junior consultants and interns on infection prevention and control, lab system, public health, etc. So for that component, you just have to follow the pages of these organizations. You can follow these on Brightspire. You can follow these on the website, as I mentioned, and you can also follow all of these organizations on their LinkedIn pages, because these organizations actually post their jobs on their pages as well. So you have just to keep an eye on this. And for Indus, they actually post it on their website only. And Aga Khan Foundation, you can find on the social media, and you can find on their own websites, LinkedIn, etc., etc.
Thank you so much for that, Dr. Subhan. And all of the platforms that Dr. Subhan has mentioned, I will be sharing all of the links with the participants so you guys can check those out. Again, I would like to stress how important it is for us to maintain a presence on platforms like LinkedIn, where we learn about different opportunities, and as well as we can stay up to date with all of the current trends that are happening in health as well. Dr. Subhan, we do have a little bit of time. I would like for you to talk a little bit about your professional journey as well, how you transitioned from MBBS to public health as well. I think that would be interesting. Thank you.
Thank you. So we shared it previously as well. So to some extent, I would say I always liked administrative side, but again, this journey also start, I would say, formally during my house job. That's what I said, because most of the journey starts from house job. So I was working in a neurosurgery department, and we had to go, and I mean, at that time we were facing multiple shortages of so many things: supplies, beds, ICUs, injections, etc., etc. So every time when I used to visit the office of Deputy MS and medical superintendent, um, especially the Deputy MS, almost I mean 70% of the time I would see the empty chair. So I would just realize, I mean, how much people and patients are suffering in the hospital, and then the hospital administration need to be vigilant enough to support these people. So from there, I actually decided that I'm going to be the health manager to make sure that my patient in neurosurgery department, उन लोगों को जितनी भी चीजों की डेफिशिएंसी है, जिस हॉस्पिटल में मैं हॉस्पिटल एडमिनिस्ट्रेटर हूंगा उस हॉस्पिटल में नहीं होगी. एज एन हाउस ऑफिसर, और हमारे सीनियर्स पीजी शिप में थे या एमओस थे, आई यूज्ड टू सी हाउ मच दे आर सफरिंग ओवर टू these poor patient outcomes just because of lack of resources. So soon after my house job, I joined new hospital in Lahore, and fortunately, I was promoted as deputy medical superintendent in a completely newly built surgical tower. After that, I was promoted as additional medical superintendent. I worked there for around 3 years. During these 3 years, I actually thought about public health is also very important because we were seeing so much of the data coming in our IT system on daily basis. Patients जो भी आते तो फिर वो हमारा IT system में वो enter होता था. So I just realized it's not just the people coming for instance, appendectomy. It is the people coming for instance, cholecystectomy. There are so many infections going on. How it is spreading. So then I realized about public health. I did my MPH, and then I realized, okay, now I have to study another thing, that was MCPS in healthcare system management. After that, I left that job because I thought I need to have the community exposure. So I joined Ministry of National Health as disease service officer. COVID-19 was there. I was focal person of COVID-19 in Islamabad. After that, I actually now I was looking for some international organization just to see how they are working. And then I joined Jhpiego as coordinator global health security. I worked in so many cities. I traveled across the country just to understand how much health system is there. What are the competencies? After that, I joined US CDC country office just to understand how donors are working. I was actually carrying my whole career with me. It's how you start. I mean, there are so many youngsters sitting here. You have to decide what you want from your career. It's not like, okay, you see Subhan, okay, he is for instance, I'm just saying, I'm not, but I'm saying, for instance, he is a successful person, because every person has their own definition of success. So for instance, that person is successful, okay, I'm going for the public health. It's not like that. If you see a surgeon, he is earning very good handsome amount per month, you would say, okay, I'm going to be a surgeon. No, whatever you are going to decide, it should come from your side, from within you. You should decide what you actually want to achieve. Once you decide it, put yourself on that part. So after CDC, I then came back to Jhpiego as technical advisor, infection prevention and control to Ministry of Health. And I also, I was then, I got different promotions, I would say, and now I am program and portfolio lead of global health security in Pakistan with Jhpiego Pakistan. So that's where I actually started. मैं बहुत कोई बुजुर्ग नहीं हूँ. Why I'm saying it, especially for youngsters, किसी भी लेवल पे, नेशनल लेवल पे पहुंचने पे या इंटरनेशनल लेवल पे पहुंचने के लिए लाजमी नहीं है कि आपको नंबर ऑफ ईयर्स चाहिए. वो पुरानी एक होती थी कि जब तक आपके बाल सफेद नहीं हो जाएंगे या बाल गिर नहीं जाएंगे, आप सीनियर नहीं हो सकते. नाउ इन दिस वर्ल्ड इट डज नॉट मैटर. I graduated in 2016. I completed my house job in 2017, and you can see how many years I have. And now I am also, the current chair of infection prevention and community of Jhpiego, the global Jhpiego. I'm also current chair of them. But it's how you carry your career. That's the main, I would say, message from me for all of the youngsters who are sitting here. आराम से बैठें, just decide करें कि आपको क्या चाहिए. What you want from your life and of course from the career. Once you know this, फिर prioritize करें. किसी भी अच्छे उस टेक्निकल एरिया के किसी अच्छे बंदे से मिलें, गाइडेंस लें. एक बंदे से नहीं, 10 बंदों से लें. And then decide what path you want. Once you decide it, फिर इधर उधर नहीं देखना. Then just focus on it. So that's the whole thing I would say. Over.
Thank you so much for that, Dr. Sobhan. And I would honestly like to echo that sentiment. I feel like all of the professionals in this field, especially because I have been talking to a lot of different people, and even for this webinar, I feel like people such as yourself, you responded with so much. You guys were so willing to actually want to give this knowledge to the students, to the youngsters out there, to this guidance. I don't think anyone, if you ask them for guidance, is going to ever say no. So I definitely urge all of the youngsters to definitely go and talk to all of the professionals there, learn about what their career paths are, and take inspiration from them. On that note, we're very, very happy to have you here with us, Dr. Subhan. It was an incredibly informative lecture. We're going to take away a lot from this, and inshallah, we are hoping for further collaborations with you as well. Thank you so much. Thank you for your time.
Thank you everyone. Allah Hafiz and bye bye.
Allah Hafiz. Allah Hafiz.